Mama, what's wrong with me?
I don't know, baby.
So, Mrs. Barry, your daughter's blood tests have come back, and as we talked before, the results are consistent with the diagnosis of type 1 diabetes. Emma's blood sugar levels were significantly higher than we'd like them to be.
Oh no, what does that mean?
Does this mean I'm gonna have to get needles? My friend Jill has diabetes and she has to get needles all the time. Please don't make me get needles. I hate needles.
Well, there are a couple different elements to managing diabetes. Unfortunately, this is going to be a lifelong condition, one that you're going to have to learn to live with for the rest of your life. Emma, I know this must be difficult and confusing to hear, but you're going to have to learn how to look after your blood sugar levels every single day so that the sickness that you had doesn't happen again. Don't worry, your mom and I are going to help you, but it might feel really hard at times and may include a few needles.
Unfortunately, the news is not great. Your kidney function has dropped below 1/3 of the expected normal levels.
Does this mean I need to be on dialysis?
You will likely need to start some form of dialysis in the next year or two, yes.
No.
I know this news is hard to take in, but I want you to know that many people manage to live good lives while on dialysis.
I don't know. I mean, I knew this day would come in my head. I just didn't want to believe it. What does dialysis entail?
So there are a number of different options we'll need to discuss. When patients think of dialysis, hemodialysis is usually what comes to mind first. It's a type of dialysis where your blood is passed through a machine that then removes the waste from your blood. We would need to perform a minor surgery to gain access to your circulation to start.
So Rachel, I have some uncomfortable news I need to tell you. Is there anyone you'd like to be here for this?
Well, I'm here alone today. Is something wrong, though? Did you finally figure out what's wrong with me?
We think we have the answer, yes, although this won't be easy for you to hear. Having taken a look at your MRI, we're seeing structural changes in your brain that are consistent with a diagnosis of multiple sclerosis.
Wait, multiple what? I'd like to write it down.
Multiple sclerosis, or just MS for short.
Okay.
This is a chronic disease of the central nervous system, and it can have many of the symptoms that you've been experiencing.
Oh, wow. Okay. But is this a good thing now that we know? Like, can we treat it?
Well, yes and no. I wish it were that simple. It's good that we caught it early, but unfortunately MS is a progressive disease. And although there are things we can do to slow the progression of MS, unfortunately there's no cure for it.
Wow.